Welcome back, everyone, to another deep dive. You all send in some really fascinating topics, and today's is no exception. We're going to be diving into cardiac amyloidosis,
Ooh.
which I got to admit, when I first saw it, I was like, what is this? But trust me, this is something we need to be aware of, especially as we or our loved ones get older.
It's true. It's not a household name by any stretch.
No.
But cardiac amyloidosis is surprisingly common and unfortunately often misdiagnosed.
Yeah.
Because the symptoms can be so subtle.
Yeah, that's what makes this deep dive so important. And to guide us through this kind of complex world, we're using the Medline Plus Encyclopedia entry on cardiac amyloidosis.
Right.
So imagine this. There's a protein in your body.
Yeah.
Just doing its thing, keeping things running smoothly.
Right?
Suddenly it goes rogue, start clumping together and building up in places it shouldn't, specifically your heart muscle.
Yeah, that's a great way to put it. And these clumps, we call them amyloid deposits.
Okay.
They're like these tiny little wrenches thrown into the heart's very intricate machinery. And they make the heart muscle stiff. And that's where the term restrictive cardiomyopathy comes in.
Okay, so it's not just that the heart is weak, it's that it's physically harder for it to actually pump.
Exactly. The heart can't relax and fill with blood properly, which puts a huge strain on the whole system. And because the symptoms are so sneaky, it's often overlooked, especially in older adults who might, attribute fatigue or shortness of breath to just getting older.
Oh, yeah, for sure. I'm just getting old.
Exactly.
Right.
Yeah.
So what should we be looking out for besides, the usual suspects like fatigue, shortness of breath?
Right.
The encyclopedia mentioned needing to pee a lot at night.
Yeah.
That seems like an odd symptom for a heart condition.
It is unusual, but it's actually a really key clue. When the heart can't pump efficiently, fluid starts to back up in the system, and the kidneys go into overdrive trying to flush it out.
Right.
And that's what leads to those middle-of-the-night bathroom trips.
Oh, wow. I would have never put those two things together.
Yeah.
That's so interesting. It makes you realize you really do need to pay attention to even seemingly small changes.
Absolutely.
Especially as we age.
Yeah, early detection is really key.
So that brings us to the next hurdle then, diagnosis. The symptoms, as we've said, can be tricky.
Yeah.
And they can mimic so many other conditions.
It's true.
It's like a medical mystery.
It is.
So how do doctors even begin to unravel this one? I imagine it involves a lot of tests.
You're right. It does.
Yeah.
Doctors use a variety of tools, starting with an EKG to check the heart's electrical activity. Then they often use imaging techniques like echocardiograms or MRIs to get a visual of the heart's structure and see how well it's pumping.
That makes sense.
Yeah.
Is there a definitive test, though, like a smoking gun that says, this is cardiac amyloidosis?
Often, a heart biopsy is needed.
Oh, wow.
To provide that definitive diagnosis.
Okay.
It involves taking a tiny sample of heart tissue and examining it under a microscope to check for those amyloid deposits.
That sounds pretty intense. I can't imagine that that's a routine procedure.
It's not, but it's often necessary to get a clear picture.
Right.
And once the diagnosis is confirmed, then the focus shifts to treatment.
Okay, so let's talk treatment. What can be done to manage this condition, especially given that we are dealing with, a stiff heart muscle?
Right. So the approach is really multifaceted, and it targets both the symptoms and the underlying cause. Lifestyle changes are often the first step. Things like dietary adjustments, particularly reducing salt and fluid intake to ease the burden on the heart.
Right, that makes sense. But what about medications? Are there specific drugs that can help with this kind of heart problem?
Right.
I know some medications can make the heart pump stronger, but that doesn't seem like it would be helpful in this case.
You're exactly right. Making the heart work harder when it's already stiff would actually be counterproductive.
Okay.
So instead, doctors often prescribe diuretics, which help the body eliminate excess fluid. This reduces that backup we talked about.
It eases the strain on the heart.
So diuretics address the fluid buildup. But what about the underlying problem? The amyloid deposits themselves. Can anything be done about those?
Now that's the million-dollar question, isn't it?
It is.
And thankfully, the answer is becoming more and more hopeful. Now, while we can't completely eliminate amyloid deposits just yet, researchers are making incredible strides in targeting them directly.
This is where it gets really exciting, right? I remember the Medline Plus entry mentioned different types of cardiac amyloidosis.
Yes.
Does that play a role in how these deposits are targeted?
Absolutely. It's like having the right tool for the right job.
Right.
So let's unpack these types a bit.
Okay.
The most common one, AL amyloidosis, is kind of an immune system hiccup.
Okay.
Our plasma cells, the ones that make antibodies,
Okay.
they start producing these light chain proteins in overdrive,
Uh-huh.
and those clump together, forming the amyloid deposits.
So it's like the immune system is working too well almost?
In a way, yes. It's overzealous.
And unfortunately, this type is more common in older adults, especially men.
That makes sense, given what we discussed earlier about it being missed in older folks.
Precisely. Now, AA amyloidosis is a different beast altogether. It's linked to chronic inflammation.
Okay.
Things like rheumatoid arthritis or inflammatory bowel disease.
Oh, wow.
The body, in its constant battle against inflammation,
Right.
ends up producing these amyloid proteins as a byproduct, and they wreak havoc on the heart.
So it's like collateral damage from the inflammation wars.
A good analogy. And then there's the hereditary form,
Right.
caused by a gene mutation that runs in families.
Right.
This one often shows up earlier in life.
Okay, so we've got AL, AA, and hereditary forms.
Yeah.
So, knowing these differences, how are researchers tackling the amyloid deposits themselves?
This is where things get really cutting edge. Scientists are developing drugs that act like tiny little sharpshooters, targeting those amyloid proteins and preventing them from clumping together in the first place.
So it's like intercepting those rogue proteins before they can even cause any trouble.
It is. And some of these drugs are showing incredible promise in clinical trials,
Wow.
improving heart function and even extending life for patients. It's really a game changer.
That's great news. But what about those other types of amyloidosis, like the one linked to inflammation? Are there specific approaches for those?
Absolutely. For AA amyloidosis, managing the underlying inflammatory condition is key.
Right.
By controlling the inflammation, we can often slow down or even halt the production of those harmful amyloid proteins. It's like cutting off the fuel supply.
Makes sense. So it's a two-pronged attack. Manage the root cause and prevent those rogue proteins from causing any damage.
Exactly. And for the hereditary forms, gene therapy is emerging as a potential breakthrough.
Gene therapy. That sounds incredibly futuristic. How does that work?
Imagine it like this. Scientists are trying to deliver a healthy copy of the gene
Okay.
that's causing the problem, essentially correcting the code that's gone awry.
So it's like a genetic rewrite.
A perfect way to describe it. It's still early days for gene therapy in cardiac amyloidosis, but the potential is enormous.
It's mind-blowing to think we might be able to fix these problems at the genetic level.
It is.
What other advancements are you excited about in this field?
One area that's generating a lot of buzz is stem cell therapy.
Okay.
The idea is to use stem cells, those blank slate cells that can become almost any type of cell in the body,
Right.
to regenerate healthy heart tissue and replace the damaged tissue caused by those amyloid deposits.
So it's like giving the heart a fresh start.
Exactly. It's incredibly promising, but we still have a lot to learn about how to control these stem cells and make sure they integrate properly into the heart.
That makes sense.
Yeah.
It sounds like there's a lot of hope on the horizon for people facing this diagnosis.
There is.
But I also imagine there's still many challenges and unknowns.
You're right. One of the biggest hurdles remains early diagnoses.
Right.
As we discussed, the symptoms are often subtle, especially in older adults. And this can lead to delays in diagnosis, which can impact treatment outcomes.
So awareness is crucial, both for individuals and for their healthcare providers.
Absolutely. Yeah. We need to be vigilant and advocate for ourselves and our loved ones, especially as we age.
Right.
Another challenge is the sheer complexity of this disease.
Yeah.
There are multiple types, each with its own nuances and treatment considerations.
It's like a puzzle with many pieces.
It is.
And finding the right fit for each patient requires a highly individualized approach.
You've hit the nail on the head. And that brings us to another crucial aspect of care, the emotional and psychological impact of living with this condition.
Right. It's not just about treating the physical symptoms.
Right.
It's about supporting the whole person.
Exactly.
So what are some of the challenges people might face in this area?
Well, a diagnosis of cardiac amyloidosis can be life-changing.
Yeah.
And it's normal to feel a wave of emotions. Fear, uncertainty, anxiety about the future.
Right. It's a lot to process, especially when you're dealing with a condition that's not very well known.
Exactly. And that lack of awareness can lead to feelings of isolation.
Of course.
People might feel like they're going through this alone.
Right.
Which is why support groups, both online and in person, can be so valuable.
Absolutely. Connecting with others who understand what you're going through can make a world of difference.
It can.
What about professional support? Is therapy recommended?
Absolutely. A therapist can help individuals process the emotional roller coaster
Right.
that often comes with a serious diagnosis.
Yeah.
They can provide coping mechanisms, stress management techniques, and strategies for navigating the challenges of living with a chronic illness. It's about building resilience.
So it's about taking a holistic approach to care, recognizing that well-being encompasses not just the physical, but also the emotional and psychological aspects of a person's life.
Precisely. And it's important to remember that families and caregivers need support too.
That's a good point.
They're on the front lines, providing care and emotional support, and they often shoulder a heavy burden.
Absolutely. Caregiving can be incredibly demanding, both physically and emotionally. What resources are available for caregivers?
Similar to patients, caregivers can benefit from support groups and therapy.
Okay.
There are also organizations that provide respite care,
Oh, that's great.
giving caregivers a much-needed break from their responsibilities. It's crucial to remember that self-care isn't selfish.
Right.
It's essential for both the caregiver and the person they're caring for.
This has been such a rich and insightful conversation.
It has.
We've covered a lot of ground today, from the science to the treatments to the emotional and social aspects of this complex condition.
We have.
But I think there's still one important piece we need to address: the ethical considerations surrounding access to treatment.
You're absolutely right. As treatments for cardiac amyloidosis become increasingly sophisticated and effective, we need to ensure that they're accessible to everyone who needs them, regardless of their financial situation or where they live.
Absolutely, that's such a crucial point.
Yeah.
We can't just celebrate these amazing advances without acknowledging that there's the potential for disparities in access.
Right.
We need to ensure that everyone has a fair shot at benefiting from these breakthroughs.
Exactly. And this isn't just a national issue, it's a global one.
Right.
Healthcare systems vary significantly around the world,
Yeah.
which can create huge gaps in access to treatment.
So what can be done to address these challenges?
Well, it requires a multi-pronged approach.
Okay.
We need to advocate for policies that promote healthcare equity,
Right.
both within our own countries and on a global scale.
Yeah.
We need to support research efforts that are focused on developing more affordable and accessible treatments.
Uh-huh.
And we need to raise awareness about this condition so that people are empowered to advocate for themselves and their loved ones.
It sounds like it requires a collective effort, with individuals, healthcare providers, policymakers, and researchers all working together to create a more just and equitable healthcare system.
Absolutely.
Yeah.
We all have a role to play in shaping the future of cardiac amyloidosis treatment and care.
Welcome back to the Deep Dive. We've been on this journey exploring cardiac amyloidosis.
have.
From those sneaky symptoms
Right.
to the cutting-edge treatments, it's been really eye-opening.
It has. And I think what's struck me the most is the resilience
Right.
of the human spirit,
Yeah.
even in the face of such a challenging diagnosis.
That's a perfect segue to what we wanted to focus on in this final part of our deep dive.
Yeah.
We've talked about the science, we've talked about the ethics, but now it's time to hear from the heart, so to speak.
Mhm.
To really understand the impact of this condition,
Mhm.
we need to understand what it's actually like to live with it,
Absolutely.
day in and day out.
And that's why stories are so powerful.
Yeah.
They allow us to connect with others on a deeper level, to build empathy, and to really understand the human side of a diagnosis that can often feel very abstract.
Right. It's easy to get lost in the medical jargon and the terms and everything.
Yep.
But at the end of the day, it's about people's lives.
Exactly. And I've been fortunate enough to witness firsthand the strength and courage of individuals living with cardiac amyloidosis. I remember one patient in particular, a woman in her late 60s, who came to me after being misdiagnosed for years.
Wow.
She had been experiencing fatigue and shortness of breath, which she initially attributed to getting older.
Yeah, I can see how that would be easy to dismiss, especially with those subtle symptoms we talked about earlier.
It is, and unfortunately, by the time she reached me, her condition had progressed and her heart was significantly weakened.
Oh, wow.
But even in the face of such adversity, she remained positive and determined to fight. She embraced her treatment plan, she made lifestyle changes, and she connected with a support group.
That sense of community can be so crucial,
It can.
can't it?
And for her, it was transformative. She found a network of people who understood what she was going through,
Right.
who could offer support and encouragement,
Yeah.
and she became an advocate for others, raising awareness about cardiac amyloidosis
That's amazing.
and pushing for more research funding.
Her story is a testament to the power of resilience and the importance of finding connection and purpose, even when you're facing difficult circumstances.
It is. And while every patient's journey is unique,
Right.
There are common threads that weave these stories together. The shock of the diagnosis, the struggle to adapt to a new reality, the search for information and support, the moments of hope and despair, the unwavering love of family and friends.
It's a reminder that behind every medical chart, there's a human being
Mm-hmm.
with hopes and dreams and fears and a story to tell.
Exactly. And these stories have the power to change hearts and minds, to inspire empathy, and to drive action.
So as we wrap up this deep dive into cardiac amyloidosis,
Mm-hmm.
what's the one key takeaway you want our listeners to remember?
Knowledge is power.
Hmm.
The more we understand about this condition, the better equipped we are to advocate for ourselves, our loved ones, and our communities. Early detection is crucial. So pay attention to your body. Don't dismiss subtle changes.
Right.
Seek medical attention if you have concerns.
Right.
And remember, you're not alone.
That's so important.
There are resources available, support groups, online communities, and healthcare professionals who are dedicated to helping individuals navigate this journey.
This has been an incredible journey of discovery, and I want to thank you for sharing your expertise and insights with us.
It's been my pleasure.
And to our listeners, thank you for joining us on this deep dive. Remember, every voice matters. By raising awareness, supporting research, and advocating for equitable access to treatment, we can make a difference in the lives of those affected by cardiac amyloidosis. Stay curious, keep learning, and let's keep the conversation going. We'll see you next time.